my name is Lauren Moon, and today I will be speaking about workplace communication networks and how they relate to occupational therapy. Workplace communication involves understanding how the context of organization influences the communication processes and how communication differs from other forms of organizational behavior. Within workplace communication, there are communication networks. A communication network is a pattern of relationships through which information flows in an organization. Communication networks can take many forms depending on their complexity of the organization, but we usually classify them into two categories, formal and informal. Informal communication is interactions that do not follow the formal upward and downward structures of the organization, but emerge out of less formal interactions among organizational members. Informal communication is known as the grapevine communication. Formal communication is described as the messages that follow prescribed channels of communication throughout the organization. Formal communication is known as official communication. Within formal communication, there are three different ways information usually flows: downward, upward, and horizontal. Downward communication is a message that flows from a superior to a subordinate. Downward communication is the most dominant area of research in organizational communication. Upward communication is a message that flows from a subordinate to a superior. It is said to have little effect on job performance compared to downward communication. Horizontal communication is a message between members of an organization who have equal power. When I'm older, I would like to become an occupational therapist. An occupational therapist is someone who rehabilitates people of all ages who need specialized assistance to lead independent, productive, and satisfying lives due to physical, developmental, social, or emotional problems. Occupational therapists use workplace communication every day, just like every other profession. Communication is important in any field, but in medical fields, communication is key to success. People in the health fields, like occupational therapists, must be able to communicate their diagnosis and how they're going to treat the patient to anyone who is involved in the patient's care. One of the biggest problems with communication between the patient and the occupational therapist is the difference in the terminology that the therapist uses to explain things to the patient. An occupational therapist's job is to communicate and clear any assumptions that the patient may have. Building a relationship with your patient is a very important part of the job. In order to create an effective treatment plan, the occupational therapist must communicate with the patient and involve them in the process. Communicating with your patient is an example of formal communication. More specifically, it is downward communication because you are in charge of what the patient must do. As the occupational therapist, you are considered the superior. Workplace communication helps to avoid conflict if it is done correctly and can contribute meaningfully to the organization that it is occurring in. So next time you're applying for a job or you're doing something at work, think of what the workplace communication could do for you in the organization. You never know what that may be and what the result may be.